brace myself when you say that. 10G.
Welcome. It is still Wednesday, still February 7th, and we are getting started around 1:15 with our committee. We are returning briefly to H657 because Mr. John Scott was kind enough to wait until after the lunch time to testify with us. So, John, thank you so much for joining us, and thank you even more for your patience.
Sure. Hope you all had time to get lunch.
Some of us did, yes.
A quick one, right? Well, thanks so much for having me speak today. I appreciate the opportunity to appear. I'm going to keep my remarks pretty quick because I know you all have a lot to do with this bill. But I am an attorney at the Washington, D.C. law firm of Wilkinson, Barker, Nauer. And I'm appearing here today on behalf of our client, CTIA, which is the trade association that represents the wireless communications industry. CTIA asked me to address with you its concern with just one specific provision in Draft House Bill 657 that we believe conflicts with federal law. And this is Section 17, the provision in Section 17, which would fund the new Community Media Public Benefit Fund by charging an annual fee to communications service providers who have attached equipment to utility poles. Wireless providers would, as we read the bill, be required to pay this fee for all the antennas that they have attached to poles. However, federal law prohibits states and localities from charging this type of fee on wireless providers to raise revenues for other programs. Fees must instead be limited to the actual and reasonable costs that localities incur and the state incurs to oversee permitting and the use of wireless facilities. Let me provide a little more background if I can.
Well, can I ask you a question before you provide that background? It sounds like you're describing our definition of a fee, and that sounds more to me like but what we're actually doing is a tax. So if you could talk through that in your further explanation, I'd appreciate it.
Sure. Let me cover that.
Thank you.
Sure. Let me start just by going back to the federal statute that we think applies in the situation. So the Federal Communications Act has a number of provisions in it that are designed to speed deployment and investment in telecom, including to wireless facilities. So Sections 253 and 332 of that act place limits on state and local regulation of communications networks, including the fees that can be charged. In a 2018 decision, the Federal Communications Commission ruled that one of those limits was that any fees state and localities impose on wireless providers for placing antennas in the rights of way must be cost-based. That is, and I'm going to quote the FCC decision here, any fees or charges must be, quote, a reasonable approximation of the government's costs that are specifically related to and caused by the deployment. And the FCC was careful to note that it didn't matter what the locality or state labeled the fee as a tax or a charge. What mattered was whether that fee was imposed based on equipment that was deployed along state or local rights of way. So it doesn't matter whether you call it a pole attachment tax or fee or excise tax. What matters is how it's applied. So in contrast, the FCC said that fees cannot be imposed for the purpose of raising revenues to support other unrelated programs. The fees must go to the costs for the state to manage its rights of way. And the FCC stated, and again, I'll quote, fees that accomplish some public policy objective other than the provider's use of the rights of way are not fair and reasonable and thus are in violation of Sections 253 and 332, unquote. The FCC also ruled in response to a comment that I think Ms. Warner made this morning, the FCC also ruled that these fees are not taxes that are insulated from federal regulation by the Communications Act's tax savings clause. That's Section 601 of the Act. But the FCC specifically addressed that question and determined that they were not taxes. In 2020, the United States Court of Appeals for the Ninth Circuit ruled that right-of-way fees must be limited to the costs of permitting and managing wireless facilities, and thus affirmed the FCC's ruling on this point. It upheld the decision that fees must be cost-based and cannot be used for another purpose. And in 2021, the Supreme Court declined to review the Ninth Circuit's decision. So our problem with Section 17 is that it does impose this new fee on wireless providers in order to raise revenues for this separate community benefit fund, not to reimburse Vermont or its localities for their costs in managing the permitting process for rights of way. And it's for these reasons that CTI opposes the new fee charged to wireless providers, and we urge that you amend the bill to remove it. Thanks very much for the privilege of discussing this with you, and happy to take any questions if you have time.
It seems we don't. Thank you very much for being so comprehensive. And is your written testimony available to us?
I know that CTI has submitted
Okay, great.
written testimony yesterday.
Okay.
If you can supplement that in any way, happy
Okay.
to do that.
Thank you. I just know we've gathered so many different perspectives today, and I just want to make sure that we can look at across all of them when we're.
And
Exactly.
when would that, if we were to submit anything further in response to the discussion today, when would you need that by?
Tomorrow,
That's
next
fine.
week? I don't really have a concrete answer to you. I'm sorry. Sometime this week would be great.
Okay, I just wasn't sure
Thank you.
how needed.
Definitely no one's voting this week.
Okay, we can definitely get that to you today or tomorrow or Friday.
Great. Thank you so much. And we have a question for you.
Hey, John, you mentioned that the fee that had to be related to actual cost, the true cost of using the pole. Is there some sort of established metric out there to help determine what that actually is, or is there a lot of variability out there in the market?
There is a lot of variability, and in part for that reason, one thing that the FCC did in that 2018 decision was to adopt what it termed a presumptively reasonable fee that states and localities could charge. And it set that fee as essentially for a recurring fee, that is one that's taxed on an ongoing basis, it set that fee at $270. And I do note that I'm trying to remember, the section 15 of the bill perhaps has a fee of $270 in it for wireless attachment.
That's why we're getting from. Yeah.
Yeah, so that was the number that the FCC picked. And, if the locality can demonstrate that its costs go beyond that, it can justify a higher amount. But that's the FCC's determination of what would be a reasonable fee for wireless attachments.
Okay, thank you.
Sure.
And I think before you walked in, I sort of specified that this is a tax and not a fee. And so there are some differences there. Thank you so much for joining us.
Sure, no problem. Thank you for the opportunity, ma'am.
And now, fully pivoting, we are going to hear from Dr. Levine about S18. He is in the hallway. I saw him. Thank you. Welcome. Thanks for joining us. You can sit right in the chair there. Ready to hear from you. And we are taking very scattered testimony on S18 because of a combination of the folks who can testify schedules and our own schedule. And so thanks for popping in.
I need to just get on the system so I can share my slides.
Oh, absolutely. And just some context for you. We are really doing our best to stay out of all of the health and science on this bill and stay as much as possible on the money, because I know we'll never be able to fully sort of rehash the debate that happened in the Human Services Committee that led them to vote out the bill. And I'm concerned that if we try, we'll fall short.
So all the things I like to talk about the most
Are off the table.
You don't want to hear.
That's all right. The slides are tailored to
Wonderful.
more economic analysis than a health analysis.
Very much appreciate it. Thank you.
But I will slip now and then.
I imagine you will. We will not kick you out if you do.
All right.
It's not because we don't
And
care.
now connected.
And it's not because we don't care about those
Just staying in
things.
our own lane.
We struggle to stay in our own lane on a good day, and so I am trying to.
I can share now?
You can, yeah.
I feel like I've heard enough about this bill. I feel like more people should send me. I love hearing from my constituents.
Okay, did you receive some of our written comments already?
I think that's in the slide.
Okay, you'll be getting, I think, some written comments too, but the slideshow and my talking will provide everything you need. Thank you, Commissioner Mark Levine, Department of Health. Thanks for inviting me to testify regarding this bill. This is just to illustrate the economics of chronic disease, because as you know, people who smoke do get bronchitis and pneumonia and things like that, but the majority of what are the chronic effects, whether they be cancer, whether they be lung or heart disease. And indeed, if I weren't here to talk about tobacco bills, the leading contributor to our healthcare dollar expenses, probably 80 cents on the dollar plus, is chronic disease. So when people get all excited about their own areas in health, chronic disease is what's driving costs in this country. And many of the chronic diseases on the lower left side of the slide are completely related to tobacco use, including asthma, cardiovascular disease, COPD, and cancer. The $1 billion numbers.
One of the things that I'm personally having a hard time sussing out, and it may not be possible, but where vaping is also at fault, I would love to just make sure I
Yeah,
understand.
hold the thought, because
Thank you.
it's not in the slides, but I will address it. So obviously, tobacco is a major contributor to cancer and death in Vermont. It's the #1 preventable cause of death in Vermont, about 1,000 deaths per year. And 18% of all Vermont deaths among adults over 35 are attributable to cigarette smoking, and nearly 1/3 of cancer-related deaths, leading to $188 million in healthcare costs. Now, on average, the state generates $75 million from tobacco taxes. And I have a slide that'll break that down to what tax gives what. And revenue from flavored products generates about $5.5 million annually. That amount really pales in comparison to the annual smoking-related expenditures to Vermont Medicaid, which is $94 million, and the overall smoking-related healthcare costs to the state, $404 million. If you add in things that we don't always measure, like lost productivity due to illness, the annual tobacco-related costs are $576 million. So my goal, as we go through the rest of these slides, I'll give you the sort of summary statement, is that preventing and treating smoking, vaping, and other forms of tobacco use is certainly a public health priority, but it should also be viewed as an economic priority. And increasing rates of tobacco use saves the state money. and that the tobacco-related costs outweigh the annual tax revenue.
Yeah. I mean, maybe this is the same version of the question that Representative Andrew was asking. I guess I'm having trouble reconciling the data and numbers around smoking when this bill is focused on vaping and tobacco substitutes.
It's not all, it's on the universe. And in our youth especially, we are concerned about the vaping, especially with the flavors from them. So since we have to talk about vaping now, because there's been two questions in a few minutes. So many of our youth, some of our adults, both do both. So vaping and combustible. For many, vaping can be a pathway to combustible, just like people who are trying to quit combustible often go to vaping. So there's sort of both, it's a bi-directional process. The vaping, the things that are peculiar to vaping that are less likely with combustible cigarettes are some of the things that are in the liquids that people are vaping. So there may be chemicals of all sorts, which can cause illness. You may recall the E-Valley situation a number of years ago, which was acute lung injury related to vaping that we're still not 100% sure, but we believe it was due to the vitamin E that was added to the fluids that were being vaped. There's a lot of unknowns in that as well in terms of their adverse effects. But I think bills addressing flavors in general are going to make it less easy and less likely for people to initiate the use of any of these substances, whether they're combustible or vaped. And it still serves the same purpose in the end, because there will be expenditures in both areas, from vaping-related illness and from traditional combustible cigarettes.
You want to make the
I can't break it down for you on a slide.
Yeah. And if inhaling vapors contributes to all these health impacts, do you worry about losing a harm reduction strategy that would get people off inhaling vapors to using other tobacco substitutes that one doesn't inhale to help mitigate the costs of smoking?
Not sure what.
So if I'm a cigarette smoker and then I move to a couch, is there potentially some health savings because I'm no longer inhaling smoke? And do you worry about if we ban all of those tobacco substitutes, we no longer have access to a harm reduction strategy?
I'm actually not, no. You know, a lot of people raise the issue of if I ban anything in the combustible arena that is used for cessation, like vaping. People do often say, I'm just going to vape. I understand smoking cigarettes is bad, I'm going to vape. But the data shows they rarely get off of the vaping. And they utilize that as their sort of step down, but it never is to zero to go complete cessation. So that's problematic. And on the market now, we have abundant nicotine replacement products, whether they're chewing gum, whether they're skin patches, whether they're inhalers, they're all available. So those will still be available. And for many of our Vermonters on Medicaid, those are available for free. So I'm not too worried about that because there is an option for them to utilize that isn't as harmful as we think the current options are. This slide shows just where that 75 million number comes from. So cigarette taxes, e-cigarette taxes, and other tobacco product taxes. The current year is an estimate still, because it's only preliminary data. But you can see that over a series of like 5 years, about 75 million is the average. Yeah.
Yeah. Right.
Where does the money go? I mean, is Is it the 75 million that comes in? Is there any that's specifically targeted for tobacco cessation?
I am not aware of
It's not,
you being able to make a,
there is no,
I would actually hope somebody on this committee knows better, because I believe that the
Just goes to
tax
the-
revenue goes to the general fund.
okay.
I don't want to be the expert on that.
The excise tax goes to the general fund, and then the sales tax, because it's an object, goes to the education fund. And I do believe we fund tobacco cessation programs out of the general fund, or are those all federal dollars that fund those programs?
No, there are some state dollars too, especially because of Medicaid.
Okay.
And this is just to look at the individual Vermonter. If you average it out, $1,072 per household in state and federal tax burden from smoking caused government expenditures, which adds up to $282 million. I've already mentioned the abundant chronic diseases associated with tobacco use, but there are numerous costs associated with that. Oops. With that. Sorry.
Okay. If you go to, if you go to slideshow view,
Yeah,
then like up at the top menu
right.
where it says slideshow,
Just gotta get. Oops. That's good.
Up
Directly
there.
above.
I know where it is, but it's kind of,
Oh, it's hidden by the bar.
but I've got it.
There we
There we go. Thank you.
Takes the village.
Okay. Good. And there's just a couple more. 80% of COPD, and I think that's a lowball figure, it's higher, is due to tobacco use. 1.5 million emergency department visits, that's not a Vermont number, that's a national number. 7% of Vermonters have COPD, an average of $4,322 per COPD patient per year at an annual cost of $164 million. So RTI is a firm that we didn't do this in the health department. RTI did this analysis for us. But
RPI,
RTI,
RTI, the Research Triangle Institute. So it doesn't matter. It's fine. I'll figure it out some other time. Sorry to.
I usually am quick on those. So they estimate that the efforts we've had to date saved the state $245 million through reducing adult smoking prevalence. Based on total Vermont Medicaid spending of $1.7 billion in 2021, 1% decrease in the smoking rate. Medicaid insured Vermonters over a 3-year period. It's estimated to have saved $2.3 million in Medicaid spending in 2022. And it's believed that we'll see a $16.6 million cost savings to Vermont Medicaid in 2023 due to a 2% decrease in the 2021-22 year. Part of this is to emphasize that even though we've emphasized chronic disease, and of course there's a time frame for chronic disease, you don't have to wait 20 years to see cost savings. You can begin to see some of the modest cost savings early on and achieve some of the deeper ones as time goes on. So keeping in mind that we have a fair amount of public health data that understands the impact of menthol, especially on our youth, but also on many populations that we often talk about when we think about health equity, whether that's defined by race or disability status or gender. All of those groups are adversely impacted by their habits, And those habits can be improved upon with decreasing the likelihood that they'll be acquainted with something containing a flavor like menthol. So the estimate is an estimated 600 additional adults in Vermont who smoke. They quit with a ban in place. For each Vermonter who quits, that saves an estimated $8,500 in lifetime healthcare costs. There's been modeling studies done about the impact of comprehensive flavor bans across the country, which, as you may be aware, the FDA has definitely said we're entertaining, but they haven't yet proceeded on, and it would be believed it will take them years. States, being sort of the laboratory for the country, can enact this change much more nimbly. And we definitely have data from Massachusetts, as I'll show, that menthol and flavored restrictions are shown to reduce sales and contribute to public health goals by decreasing youth initiation and increasing quit activity. Looking at the Massachusetts experience, their rates are decreasing. They talk about a $477 million decline in healthcare costs, with a 1% decline in smoking. People always come to the table worried about merchants and retailers and the impact, and I think that's justified worry. However, I don't think the data from Massachusetts at least supports that worry. There was, for about a 6-month period, a benefit to New Hampshire retailers by people traveling in and purchasing in New Hampshire. Other than that, no other state and no other time frame has been demonstrated to have an impact on the state's own retailers.
Presumptions.
How do we track that with like online sales? It seems like there's so
Yeah.
many different ways other than just
Oh,
getting in
there's
a car and driving to a store in a neighboring state.
Right. I don't know how they tracked it. We certainly are looking at that in our own because, as you know, several years ago, we put serious restrictions on underage online sales, online purchases. Can't always influence the sales. So I think we will continue to follow that data, but I can't tell you how Massachusetts.
Can you speak more to our effectiveness or not at limiting
Yeah, no, we've
underage
seen,
online purchasing?
yeah, no, we've seen, we saw a nice improvement and then we saw not a return to back to where we started, but a slow increase back. And youth, when we survey them, which we do frequently, talk about the likelihood of them being able to purchase. And somewhere in the 50+% range say they believe they could easily get the products.
From an online retailer or from
From a way that we would have presumed was restricted.
Okay.
So, could be an online retailer, it could be from an older person. The nice thing about, the 21-year age, as opposed to the 18-year age, is that you're much less likely to have 21-year-olds interacting with middle and high school students than you were 18-year-olds. Sometimes are high school students, but often they've not just graduated. I think there's only,
Representative Meadows.
So Massachusetts, if they're declining at 1% a year, or is that just showing a 1% decline results in?
yeah, they've only had this for several years. So I think we're talking a 1% decline that they could document.
Okay, so it appears, just backing up a few slides on ours, just based on revenue, we're declining faster without even a ban in place.
Which slide do you want me to go? to?
Just back in the Vermont generates around 75 million annually for tobacco
Yeah.
taxes.
Although I wouldn't want us to rely on the 66 yet,
Right,
because that's not full data. But clearly the trend, if you want to start with 2020 down. So I agree with that.
and then are we Would so the prohibition on a flavored tobacco substitute or a menthol cigarette,
Mhm.
those folks are showing that they're just stopping cold turkey, or are they going to like a nicotine?
Oh, I'm sure,
Gum
yeah,
or-
knowing how hard it is to stop cold turkey, I'm sure they're doing something.
Doing
besides that.
something else?
Whether it's a nicotine replacement, whether it's a Chantix or bupropion medication. I'd also point out on the slide that the e-cigarette tax actually is going in the opposite direction from the traditional cigarette tax. Yes, so this could actually have an impact on the one tax that is going wrong.
And would an e-cigarette, is an e-cigarette healthier than a combustible cigarette?
We would never say so.
Okay, I have no idea. I've never done either, so I have
Yeah,
not.
So, you know, the full data isn't in, but clearly, you know, that E-Valley epidemic was a serious thing. The rates of asthma and reactive airways is still well known. The unknowns about all of the metals, chemicals that are in the vapes
Mhm.
themselves are still concerns. And, if you will, the pathway to combustible cigarettes. And that's without even mentioning the word nicotine. Because the whole idea of restricting nicotine in youth is, and I'm not dramatizing, it is the gateway drug.
Mhm.
It kind of molds the brain chemistry and allows alcohol, cannabis, what have you, to sort of enter into the picture over time, because the nicotine addiction is the same brain centers that are active with these other substances. So it primes the brain is kind of the word that is used.
No,
So with youth, you know, we're not worried about them getting lung cancer in the next 10 years, but nicotine addiction is serious, and I don't have to be the one to say that. Invite any school teacher, principal, or superintendent in, and they will tell you many tales of their concerns about what's going on in the school environment right now, in the bathrooms, what they've confiscated, and the impact on kids who get so addicted that they have to be using constantly. It's a tragic situation.
I always appreciate your curiosity, and I want to make sure Dr. Levine has time to finish his presentation.
I think this one slide, summary slide. And I gave you the summary when I came in. That, you know, it's a public health priority, it's an economic priority, and we will save more money than we receive right now through revenue with activities like we're proposing here in that bill. And there's a sort of a table that gives you an estimated cost, because we can't really say what the decreased smoking rate would be in the Medicaid population, but there's a sampling of realistic numbers going as low as 0.5% to as high as 3%.
I would like to ask you a question that's slightly awkward, but I'm going to ask it anyway. Is it safe to assume that you are not here in your personal capacity, but here as a representative of the administration?
Sure.
In support of this bill?
So I can't speak that the administration is in support of the bill.
Okay,
I can't say that the administration is actually against the bill either.
okay,
We don't have a definitive statement yet, though
okay.
the governor has publicly stated there are things he supports in this bill, and that, you know, he,
And you're sharing with us the benefits of the bill?
yeah,
Okay,
yeah.
thank you. It's quite a thread we're all walking. Okay.
I'm not saying anything that the governor hasn't said in terms of the bill. He just hasn't come out and made a line in the sand about it.
We wouldn't ever want lines in the sand. Thank you very much. Appreciate that. We have a few more minutes now that the presentation's done, if anyone has further questions. Yes, Representative Brannigan.
This is again slightly off topic, but sadly, a few years ago, the legislature approved cannabis, made it legal. Have you had any help, anything indicating whether people's health has gone downhill since that was legalized, or
Yes.
could you tell me about it?
Yeah, so I have to be careful not to overgeneralize about like the Vermont population, but the things we have seen. Number one is emergency department visits for very young kids. Usually because of getting hold of edibles that were in the home and ingesting them. And of course, they can have prolonged effects. So, and that's what other states saw right off the bat too, is increased emergency room visits. Second thing is the syndrome called cannabis hyperemesis syndrome, which is a curious syndrome of recurrent episodes of abdominal pain, vomiting, and people who, it's strange, cannot make the connection between the two and refuse to make that connection, but it's very highly associated. And they're quite frequently in hospitals, just that the idea you can't take it fluids or I don't think we're seeing a lot in the asthma realm, but I would predict we might, just because for many people smoking is still a pathway of ingestion. And the public safety people know that they can detect more cannabis in people who are pulled over for whatever, impaired driving, but it doesn't necessarily mean it was the cannabis, because they may also have been using other substances like alcohol. But
Thank you.
those are the things that are seen.
Representative Andrews?
Dr. Levine, so shamefully, I'm a former smoker and I have gone through the.
You should say, I'm a former smoker, I'm proudly, yeah.
Glass half full, I appreciate that. But I remember how hard it was to kick nicotine addiction, and I'm being told that vapes in particular have like a way higher concentration of nicotine. Do you want to put a number to that, or can you put that number to that? Because I'm hearing like crazy numbers, like 20 packs of cigarettes.
Oh, yes. One of those vapes, I don't know all
It's okay.
the names of them,
Unicorn.
but there's one that you can obtain that literally it's 500 times the amount of nicotine in a pack of cigarettes. And when we used to talk about Juul, when they were the bad players, what you got in one liquid canister for Juul was so many packs of cigarettes, and you're getting it all at one time.
Yeah.
So this is real.
How many puffs are in a,
100
so it's 100,
drinks maybe.
100. I guess I'm like trying to scale the whole,
Depends how big of a drag, right?
Right.
very big drag. Representative
And
Mendoza.
don't get me wrong, like, if somebody was smoking regular cigarettes, I'd gladly let them use a vape if that's the only thing they would accept to quit. But God forbid you let them use a menthol vape, because they're never going to get off the vape.
Yeah.
So if they only need the nicotine, and that's the part of the addiction that they're having trouble with, an unflavored, non-menthol vape would still be better than smoking cigarettes, for sure. But we and the Surgeon General's office and the FDA and multiple others are very cautious about saying this is an approved way to quit smoking, traditional smoking. Because first of all, the answer isn't in. Second of all, the proportion of people that never leave the vapes is really high. And there are, so as I pointed out earlier, so many other ways that we can offer people cessation treatments. And we do offer them. And in Vermont, we've got Vermont Quit Line that you can call. We've got texting. We've got web-based. And we've got free things for the Medicaid population that are really, I think, wonderful and have really helped a lot. So.
These are our last two. If anyone's planning on asking a question, please raise your hand now. Representative Anthony, okay, Representative Anthony and then Representative Sims.
Very quickly, given the dramatic, more intense delivery of nicotine, as you described it through vaping, is there no opportunity to regulate that as we have THC concentrations and whatnot? I understand one drug is legal and the other isn't, but I don't see why we wouldn't be able to limit
Funny-
deliveries,
Yeah.
delivery intensity,
Yeah.
concentrations, et
Yeah,
cetera.
funny you should mention that. I wouldn't
Again,
do
I
it,
know that's not a Ways and Means question, but it keeps coming up.
but it's an important question. I wouldn't do it at the level of a state. That I would do at the level of the Federal Drug
Yeah,
Administration.
okay.
But they have actually talked about it. We talk about it in our talks about the impact of tobacco products and vaping products on the population. We talk about regulating nicotine levels. They are actually now talking about it as well. So just the fact that they have started talking about it is a positive sign, because you're right. How much nicotine does one need to get through their day? For sure.
No sense, get the last word.
Yeah, two pieces here, maybe to this question. Can you just talk a little bit about what we know about prohibition being an effective strategy for reducing harmful
Never
substances?
been a strategy, right?
So I guess I'm having trouble reconciling prohibition not being an effective strategy for reducing use of harmful substances, and maybe what we know are maybe more effective education and outreach and some of the other things we were just mentioning. And I guess would feel like some inconsistencies for me around decriminalization of harmful substances as a healthcare strategy, and what, like, we aren't having this conversation about banning smoking, which is what most of your presentation has been about, and we don't have this conversation around margarita mixes, and we are actively talking about decriminalizing, cannabis is legal now, so it just feels like a really different direction than we're heading on.
Yeah, so
We understand that.
Yeah, so, we were talking about prohibition of menthol as an added flavor. People can still vape using tobacco taste vaping. Okay? So menthol is a problem for everyone because, number one, it eases initiation into the habit. And number two, it reduces the likelihood of ever leaving the habit. It's really challenging. And number three, all the health equity reasons. The industry has targeted youth, has targeted African Americans, has targeted the LGBTQ community. Numerous examples of how populations are differentially suffering compared to the average person. I agree that marijuana may be a little different, but the reality is we have a bill up there about potency limits. And cannabis THC is often vaped. So we have concerns about potency limits because we know the rate of people developing psychosis and people developing other adverse health outcomes from high potency THC. It makes it harmful. Whereas the average person with THC levels that are far lower than are used today, maybe when I went to college, very different ballgame. So not banning that may be different than banning a certain extreme form of it.
I guess the way I think of it is sometimes, is that banning menthol or banning lead in paint or whatever it is a consumer protection measure, can be seen as a consumer protection measure rather than as a criminalization measure. So it's about the substances that make the other substance more harmful as a way of sort of minimizing the impacts while people still can make their own behavioral choices. That's one way I might thread that needle.
Yeah, which is a discussion that Senator Sears is having in the Judiciary Committee about xylazine, which has been added to opioids and are causing people to die, causing people to get these horrific wound infections, etc. But it's used by veterinarians every day for large animals and can't be banned. But can you ban it for human sale? It has no use in the human pharmacopoeia, and it's only causing harm. So there's a slippery slope for everything. I completely agree, but there's also a great rationale, and the chair has actually given me a great answer.
What I'm
I'll
here
use that one sometime. Right, yeah, that's one of the names, right? Yep.
My wife.
Thank you very much for joining us.
Well, it was last minute, but I'm glad we could pull it off.
Appreciate that it worked.
Thank you. And you did receive something, Lisa? From the,
Slides.
okay.
And you all are welcome to sit over there once he manages to exit the room. Oh, yes. Treasurer Pichek, are you there with us? At the computer?
Sorry, yes, I am.
Wonderful.
So it's deep.
We're gonna rename you.
Increasing. Yeah. But the rate of cigarette is.
Perhaps you could turn on your video and welcome to the Ways and Means Committee. Ah, hurrah, hello. Dr. Levine still seems to somehow still be in our meeting, but that's okay. Okay. Welcome. We're really glad you can join us. I heard you did a report and we'd like to hear about it.
Yeah, for sure. That would be great. And I think we sent over some slides as well that aren't critical if they can't be shared, but they provide a good overview of sort of the charge of the report focused on climate infrastructure financing, and then also our stakeholder engagement process, and then our recommendations that came out of it as well.
So we like to have our guests share their slides, but that's very hard to do on an iPad. So we are happy to follow along on our own computers.
All right, sweet.
You gave us 4 different documents. Is the report and financing report and recommend? Is testimony Ways and Means the right one? Yes.
Yeah,
Okay, great.
I think we sent along a summary of the report, the full report, and then just something that was sort of happened separately from the report, which was this initiative with ANR and the governor's office to focus on climate resiliency that was announced a month ago or so. But the report originally started from back in May into June, when the pre-July flooding. So the thought was really focused on the IRA and some of the federal funds that are available under the Transportation Act, and making sure Vermont was coordinating and communicating with each other in terms of all the different agencies, both public and private, that would be going after the IRA money and the transportation money. And then when the flooding hit in July, some of our work pivoted to focus a lot on resiliency specifically. And just the big picture on that was that, there was some money in the IRA and Transportation Act, we thought, relative to resiliency, but a lot of it was around CO2 reduction, greenhouse gas reduction. So we viewed resiliency as being something that needed its own focus, and it didn't necessarily have a dedicated revenue stream in the same way that some of the other options do under the federal funds that are available. Now, they're dedicated funding streams potentially within the state of Vermont, but just in terms of new monies that we could be going after from the federal government. So the act that passed this was back, as I mentioned, passed last year. They asked us to look at coordinating the state's efforts on climate infrastructure financing in particular, creating a framework for collective collaboration among Vermont organizations and agencies, and the instrumentalities of the state of Vermont to maximize the federal greenhouse gas reduction funds that Vermont may receive. And the greenhouse gas reduction funds was a very specific part of the IRA and the transportation bill. So there's a lot more broad opportunity there than just the greenhouse gas reduction. And then the coordination and deployment of these and other greenhouse gas reduction funds among Vermont. So we had a number of community engagement sessions with specific industries. Anybody was welcome to attend those. We had a comment period where we received a lot of feedback and a lot of comments and ideas and suggestions. We put the full scope of the public comment and also a synthesis of all of the comments we received into our report. So if people are interested in seeing that, it's all available. Brian Lowe worked with us on the report and its drafting, and did an excellent job for us in coming up with the recommendations. And there are at least 2 that I view as very sort of actionable. One does not require legislative authority. We're planning to move forward on it in the next few months, and I think it will really be of a help. But The first recommendation was around convening through the treasurer's office a biannual half-day climate financing meeting, and I guess I'd sort of call it the Climate Finance Roundtable. And the thought here was to bring together everyone that is working on climate financing in the state of Vermont. So this could be banks and credit unions. It could be various agencies with the state of Vermont. Could be the instrumentalities of state government like VITA or VHFA or the bond bank. Could be nonprofits. It could be federal government. But basically everyone that is working on climate infrastructure or climate greenhouse gas reduction financing, and making sure that we meet, and our idea is to meet twice a year. And the idea is to collaborate, to discuss what everyone is working on, what funds are available, what federal opportunities that they're seeking, making sure everybody's aware of the various federal funds that are available and the various grants that might be available, identifying if there are gaps in the funding, identifying if individuals aren't going for certain federal funds that they should be going for, building in an opportunity for relationship building and networking among all of these sort of different areas of government and the private sector as well. And there's no real mission in terms of like what kind of there's no report, there's no policy development that we're asking of this Climate Finance Roundtable. It's simply an opportunity for collaboration and sharing each other's work and trying to build relationships so that they can offline also find opportunities for partnership and collaboration. So I think that'll be a big help over the next couple of years as there's more and more funding available and there's more opportunities. We want to make sure people are going after all of the various buckets that exist. I think, at least in the state of Oregon, they had a calculation of everything that they could be focused on. I believe it was like 140 different specific line items for different grants relating to climate financing from the federal government. So it's a lot to keep track of, but I think if we collectively do this together, then that's what I think the real benefit will be. Another actionable item out of the report that we would need legislative approval and authority to do was this concept of creating a climate credit facility. And the reason we suggested it is because we had a lot of success with our 10% in Vermont program that we have expanded and used to focus on housing. So through that facility, we can use up to 10% of the state's cash on hand for economic development. And we identified housing as the #1 economic issue. And we partnered with VHFA, with VITA, with Northern Forest Center. There's some more money available there. There might be additional partnerships that we'll announce in 2024. But we really were able to get the money out quickly through trusted experts, people that were able to, from a risk perspective, provide us really good risk protection. The money's having a big impact because it's a low interest loan in this time of high interest environment and rising cost inflation and whatnot. And thought it was a successful model to think about generally green energy production, weatherization, electrification, and then also potentially resiliency as well. But instead of having that dedicated economic development focus, it would have that focus on those 4 things: on green energy production, weatherization, electrification, and climate resiliency. So our proposal in the report was to have a fund that would have 2.5% of the state's cash on hand be able to lend out in a credit facility. And it would have a similar governing framework where the treasurer is ultimately the one that decides how much we can lend out and to whom, but that there's an advisory board made up of some of the instrumentalities of state government plus ANR to get a broader, more environmentally focused group of experts together. And that we would similarly try to find partnerships where we can lend out at a low interest rate these funds to try to make a similar big impact in those 4 principal policy areas. So that was a proposal in our report. It's something that the concept of which was also included in the House bill. I think it's 585 maybe, or 58 something. I think it's 585, but we have some additional language that just in terms of the structure and the governance of that 2.5% that we've been working with Representative Dolan on. That language was sort of sort of an early marker in the sand to make sure it was included. But that's the general concept, is to try to create that credit facility that's focused specifically on electrification, weatherization, green energy production, and then also resiliency. But I
Have
think
you sent us
resiliency,
that new language?
I don't believe we have yet, but we're happy to do
Okay.
that. We sent it to
That would be
Representative
great.
Dolan just this morning, but we're happy to send it to you as well.
I think it's all out of Representative Dolan's hands at this point. So if you were able to send it to us, that would be wonderful. Thank you.
Yeah, great. I know Ashlyn's listening, so she'll get that done.
Thanks, Ashlyn. Back to you. I'm sorry I interrupted.
Oh, that's all right. I thought I saw a hand. I think I'm sort of at the end of the meat of the report, so.
Oh, okay. So my question then about the meat of the report is, you just spoke about in recommendation number 4 quite a bit. But we've been spending a lot of time talking about number 2, which is the technical assistance.
Yeah.
Which seems really important.
Yeah, so I'm happy to talk about that. The only reason I didn't touch on it is because I think it is very important. The recommendation wasn't necessarily like the most actionable, because we were identifying it as a problem and as a challenge that we heard consistently in the feedback that we were getting through the public comment process and through the stakeholder engagement process as well. And the concern focused on both like state programs, but also federal programs that a lot of local municipalities didn't have the bandwidth or the expertise to go after federal or state opportunities. And, there was one example in particular that we heard that a town spent, maybe close to $100,000 going after a particular grant, and then they ended up not getting it. And I don't remember if it was a state or a federal grant, but they described it having a chilling effect on, their interest in going after the next opportunity. So we really had that highlighted over and over during the public engagement process as an issue. And I think basically for our recommendation, it was wanting to highlight that as an issue and try to think collectively about ways to try to strategize and provide more technical assistance to these local municipalities.
And then I understand that we are struggling to draw down the federal funds that I think our, congressional representation has worked so hard to get for us. And so I understand that you're looking further into the green bank. Would the credit facility be able to be expansive enough to be able to draw down those funds as well?
Yeah, I think the credit facility would be a good place to start. There's, for example, the bond bank just executed on the first, as far as I know, the first in Vermont provision under the IRA that allows not-for-profits or municipalities to get a tax credit for solar production. And I think it was the town of Charlotte. And previously, you either had to be a for-profit entity or you had to have some sort of complicated relationship to get the benefit if you were a nonprofit. And now there's a sort of direct relationship under the IRA. So the bond bank is financing the full thing, but then they're going to get this 30% credit back once the process is played out. And that's just an example that I want to use because it's tangible and it's happened in Vermont. But you could imagine a program with the bond bank through this credit facility where we are specifically trying to support that kind of drawdown of those IRA tax credits for nonprofits and for municipalities. There are a whole host of other areas where either through VHFA or through VITA, we could also be providing some of that credit facility to try to enhance some match or enhance some opportunity under the IRA. So for me, it's sort of a first step and it's sort of an opportunity for all of us to get smarter in what's available and have some resources to try to go after those IRA resources. But I don't think it's necessarily, the silver bullet or expansive enough to sort of solve all of the challenges around the match and the other funding that has to come to bear to get the full benefit of the IRA.
Because I think one of the concerns that we've talked about a lot in committee already this session, and other people can ask questions, I promise. is exactly what you described in that need for technical assistance, is that we have so many different pots of money in various places for pieces of projects. And that people, we're asking towns or organizations with really limited capacity to run around and make those stacks themselves. And I'm concerned that essentially what you're talking about here is adding just another place that someone needs to go to chase resources. And what we're starting to think about is sort of, one fund to help them all, that everything could sort of be subsumed under in an ideal universe. And I understand that's really, it's a big lift. But I think the more we can, rather than creating a new thing, create a new thing that picks up two old things in it, we're 10. We're just going to make things a lot easier for our towns to get anything done.
Yeah, I think that I view the credit facility, right, as partnering with existing entities though. So like sort of leveraging their work. And those entities are ones that we work with closely and have a good relationship with. There could be others that come in and want to partner. So it wouldn't be something that necessarily a town could directly access. It would enhance the work that's already happening. So I guess I would just try to frame it maybe a little bit in that direction. But I agree with you, like creating one more thing was sort of feedback that we got during the process as well. When we talked about the idea of a green bank, people felt of two minds on that, but we heard a lot of individuals say, we don't need one more thing. We really just need a front door to be able to get into and access. And part of the thought around the collaboration, the sort of the climate finance roundtable was, in some ways, although it doesn't provide technical assistance, it could be sort of a front door for a lot of the individuals that participate in the roundtable, but also for us at the Treasurer's Office and potentially the Climate Office as being sort of the front door for anyone that wonders what kind of financing is available for climate in Vermont. So it's not, it's not totally comprehensive because it doesn't have the TA piece, but I think it does add to that coordination and collaboration to be able to facilitate those climate roundtable meetings.
Okay, thank you. Hans, Representative Anthony, you had something?
Thanks. Appreciate all this work and these recommendations. And maybe just kind of building on what Chair Kornheiser said, certainly agree that the more we can move towards a one door model, the more helpful that is by small under-resourced capacity communities. And I'm also kind of curious about the other side, and maybe this should be developed later, but how are you thinking about the deployment of these funds? And hopefully we're growing the pie here, but there's never going to be enough. So how do we prioritize who the eligible entities are, and making sure that the dollars go to the most vulnerable or at least able to access these resources, in addition to working with all the usual partners who are at the table doing this work? Have you thought ahead?
No, it's a great question. I mean, one place where we've heard there's a great need, and if you put this 2.5% facility in place and just opened it up, you might find that green energy production, like solar development and like would sort of fill up all of the whole capacity of the fund, right? And maybe those are good investments as well. So maybe from a risk standpoint, that would be attractive. But I think the weatherization piece is something that needs a lot of more resources, and it needs patient capital, which is potentially could be as well. So I think part of it is trying to make sure we are focused on those items that might not have other resources available to them, or at least resources that are affordable. And I think weatherization is one that we could work closely on to try to develop a partnership with someone, and then a program that sort of provides more funds in a longer term way to help homeowners and businesses and nonprofits. Separate from that, in terms of prioritization, so I think that's one thing we want to try to prioritize, I guess is my point. In terms of broader prioritization, that's a challenge too. And I think that's partly why I was interested in working with ANR and the governor's office on resiliency, at least, because that's going to be part of that work is not just identification of funding sources and identification of need and projects, but then trying to actually provide a framework for which projects do you tackle first to get the most benefit from, and then where do you go next, and then where do you go next. So on the resiliency front, I think we still need to try to get a sense of that prioritization, as you point out. I think on the climate reduction side, green energy production is critical, but we'd also want to prioritize weatherization.
Okay, and I guess I'm also curious, as you were working on your recommendations, and maybe this is more like putting your former DFR hat on, did you all look at insurance assessments as a possible additional way to raise revenue into the space that, would help mitigate insurance claims after the fact of a weather event by investing more upfront to mitigate that risk?
We didn't look at it specifically in connection with the report. Our report was looking primarily at, trying to pull down the federal funds, although we came up with this 2.5% concept, partly because there's no appropriation component to it. It's something that we can do. And the appropriation component, the cost to the state would be that difference between a low interest loan and a market rate loan, or a market rate CD or deposit that we might get. So it's relatively small for the amount of money that you can put out and the impact you can make. In terms of additional revenue, though, because we've talked about this before, in terms of the insurance industry, I think generally the concept of trying to get ahead of some of these losses that you're going to see, is one that is a good one. I mean, because that's sort of for everyone's benefit. The losses don't happen, the premiums don't go up, the insurance companies don't have to pay out. How you fund that, you could envision insurance companies playing a role in that because it's to their benefit. The thing that I've heard from I guess from potentially from DFR, I don't know if you've had them in to talk about this, but there's that complicated retaliatory tax structure that exists. So just trying to work through that would be the thing that's critical in thinking through that piece of the insurance process.
Thanks. Representative Anthony?
Yes, and thank you, Mr. Treasurer. I was thinking, following our chair and Representative Sims, that your green fund could be viewed, you could call it a front door, you could call it a parking lot, but it would be the stacking vehicle, and then access to that fund would be much simpler for smaller people to fund a whole project instead of themselves doing the stacking. That would simplify things immensely. You could pick up the splinter pieces, stack them, and then actually fund specific projects in whole out of that fund. But another observation I would make is when we reviewed the potential draft language for the 2.5% participation from state, if you like, cash, I remember Ledge Counsel O'Grady saying, I'm not sure I understand what the 2.5% is of what. The language was very loose. And if you meant it was average daily cash balances, it ought to say that. It didn't.
Yeah, thank you, Representative Anthony. I think the language we'll send, or Ashland will send to the committee, will have that very clear, because in our draft language, we tie it back to our 10% or our LIAC statute rather than the VETA statute. So that framework already exists for that calculation.
Thanks.
Other questions from anyone? Treasurer Pichek, do you have anything else you'd like to share with us on this topic? We actually have more time somehow. What a funny day we're having over here.
No, I think we hit on everything. I mean, I am, we're planning, my hope is that for this climate finance roundtable, that we can have our first meeting in the next couple of months. So if there are legislators who are interested in seeing how that goes or participating themselves, we're taking a more the merrier approach to it, because the idea is to get everyone together in as broad of a way as we can to share what they're working on and also build those relationships. So there will probably be a hybrid, an in-person and a remote option. So we'll keep everyone updated on that.
Thanks, Representative Sims. Turns out does have more questions for you.
I mean, I'm sure this is like a pretty basic question, but can you just explain to me the cash balance concept? We're like not using revenue because it's against the interest that you're making, or I don't know.
Yeah, no, I'd be happy to. So this concept of the 10% in Vermont, it started about a decade ago, and we expanded it last year because our cash balance grew so significantly during the pandemic. And part of that was federal funds. Part of that was our state budget bigger. We had more revenues. So everything in our, daily cash balance, what I would think of it as is money that's been appropriated but not yet spent, or monies that we've received that have not yet been appropriated. So it's kind of this money that's waiting to be spent. And we're kind of taking a second bite at the apple by saying, there's always money going out, but there's always money coming in. And that average used to be in like the hundreds of millions of dollars. And now it's closer to like $2 billion. And we don't think it's going to stay at 2 billion. We think over time it will come back down, and maybe it comes back down to 1.5 billion. Maybe it's 1.25 billion. But with that money always coming in and always going out, it provides us an opportunity to lend some of that money out and get, like I said, a second bite of the apple on certain policy initiatives. So we've lent it out on housing. This would be for climate, and climate action, I guess, most broadly. What you're potentially giving up is, we could get 5% if we just left this money in the bank, and then that's our interest that we've earned as a state. And that's now grown to like the fourth highest dollar amount in our budget because interest rates are so high and our cash is so high. So we're doing pretty good on that. So we're just talking about slicing off a little bit of that daily cash balance to have this specific impact. And we still get an interest rate back. It's just below market because that's part of the rationale, is to try to support, in this case, housing, or in the case that already exists, housing, but in this other case, climate action.
Will all this work when we return to more normal cash balance levels next year?
Yeah. So we are being conservative with like our approach to it. The 10% in Vermont would mean at this moment, if we were to go to 10% today, that we could be at $200 million under that particular facility. But we've only gone to 100 million, and we have, loans that are out for a few years. We have loans that are out for 5 years, for 10 years, for maybe 15 or 20. But the goal is to really manage that process so that if our cash balance comes down dramatically, you stop lending out new money, you get monies that are getting paid back from loans that you've already made, and you sort of manage that down to a different level. But we've added in that conservatism by only really going up to 5% of what the capacity is, because there's that uncertainty with the federal funds. But our budget has just grown organically from corporate income tax, from personal income tax, from other revenue sources. So the daily cash on hand has just grown as a result of that, and just general inflationary growth as well. So I think the new normal, once everything settles out, our team thinks it will be above $1 billion. And so we have confidence that we'll have plenty of liquidity to pay all the things that we need to pay.
Thank you. Representative Anthony?
Yes, thank you, Mr. Treasurer. In your response to Representative Sims' question about where does all this loose cash or daily balances come from, you mentioned that some of it arises because of money that's received but is not committed. And I guess I would just opine that I'm willing to bet, as the curtain falls on ARPA money in a year hence, if we need to have a committed parking lot for those funds other than them having been clawed back, so to say.
Yeah, I think that would be critical to make sure that none of the federal money has to go back.
Thank you.
Thank you so much for joining us today. I really appreciate it.
Yeah, no, thank you. Thank you to your committee.
Last Friday, I gave, we had sort of a homework time, and there are 2 reports I left off. One of them is this, 100-something pages. Would love if at least 2 people in the room could read it. That would be great.
Which now?
The report that we just talked about.
Oh, sorry.
Yep.
Oh, and
that's
Chair
on our page for today.
Kornheiser, just
Yeah.
a lot of the 100 pages is we put comments in there from everybody. So there's probably like there's probably 15 to 20 pages of like a substantive report.
Oh, thank you so much for telling us that. Great, that makes it such a kinder assignment. Thank you very much for joining us. And the other one's actually the school construction task force, which
Oh,
you were
yeah.
also instrumental in. And so if a few people could read that, we are certainly going to spend significant time on that, likely this session even. So that one, I might not have as much of a 20-page cheat sheet in it, but I think is really important for us to dive into. So would appreciate people focusing on those two reports as well. So I think we're done with this agenda item. Thank you for joining
Great.
us.
Thank
Appreciate
you.
your time.
Have a good day.
We've talked about 8,000 different things today, but and I'm sorry about that. It makes my brain a little swimmy. I imagine it makes all of your brains a little swimmy. But to go back to 657, that's the telecom bill for a minute. Wondering what folks are sort of needing, wanting. Are there more? Yes.
Would it be helpful just to remind everyone of the 5 different elements of the bill?
If you want to. Yeah, we could do that. And then curious about further witnesses that people are interested in. And if there were sort of comments that we heard today that feel a strong need for editing related to them. So do you want to summarize the 5 points?
So there's the cloud tax, section 1, piece 1, and then there's the repeal of the very old telephone personal property tax, getting rid of one of the 35 little taxes. There is the state right-of-way charge, which is on the books but not being implemented, and this proposes implementing it. Another option would be just doing away with it, but as the chair said, it doesn't seem great to maybe have something in statute but not follow through with it. And there is the pole attachment concept, creating a special fund for public access TV, and the universal service fund, moving from the percent charge to a per line fee to stabilize the declining revenue. So bunch of different pieces, and it would be helpful to hear what people are on.
For me, the clearest thing is if we're going to do anything with the right of way, we need to have the agency of transportation in. But what else?
I have, like, my brain's swimming a little bit on the pole attachment fee, and one thing that I think I heard that is giving me pause on it is that the dollar amount that's recommended in the bill is pretty high compared to like what pole attachment fees are when they're talking about this company to company attachment. So I guess what I would love to see, and maybe I'm a little over my skis, as we say, but I'd like to see some mathing about what that gets us and what the need is and like how that aligns so that I can feel better about if that's the right number.
Yeah.
I think, I made a comment to Lauren.
Yes.
To when she was testifying, and, I think, for the folks in my district who really, it doesn't have a local bearing. I mean, yeah, they could watch, stuff from other towns, but not from towns in the district. It's a lot of money for them to be paying to a system that really doesn't benefit them. And I think for the towns in my district, there are 4 towns in my district, only one of them is hooked up to EC fiber. The other 3 aren't even, don't even have broadband yet. And I think that seems to me like that's if there was gonna be money going to something, as a result of all this, that would be the thing to spend money on rather than providing a service that folks may not be joint, it may not be, just relevant.
With the cloud tax, I would like to hear more about the business to business part of it, and whether that should be exempt from it.
Any other thoughts from anyone? Okay. Are questions about pole attachment, questions about where the money should go. Questions about cloud and business to business. I have questions about right of way. Yeah, Representative Beck.
Also, as it relates to the cloud, and the other idea, it's the, the concept of digital manufacturing input.
What does that mean?
Yeah, I'm like,
Well, maybe that's
Oh, that's the business to business.
well, I don't know. I mean, I'm thinking of where like, a business buys software to run machine learning. Okay, where we give an exemption if the business purchased the drill press. But do we also want to exempt the sales tax on the program that runs the whole operation?
And that exemption is something that we passed 3 years ago or 4 years ago. The manufacturing exemption.
Right, I'm talking about in the
Yeah, I'm just-
context of software.
Other people on the committee might not even know about the manufacturing exemption, so that's why I'm bringing that in.
Yes.
Representative Maslin.
Question in regards to your question, the question for me would be, are they buying the software to set up the drill press and then run it? So it's basically a one-time like setup purchase, or is it something that's every time they turn the machine on, it's plugged into the internet somewhere, and that's a different application, right? The latter would be taxed, and if earlier one would not. You buy it, tax it once. It makes sense. Okay.
I'm not hearing anyone say anything about the per line fee or the telephone personal property section.
That's all good.
Okay, those are both all good. Okay. Clear question about cloud. And what else? Yeah, Representative.
One piece of testimony that I did not get a chance to ask Maria whether she agreed or not. One of the presenters said that there is an FCC regulation, and I think this had to do with Lauren Glenn's piece of the bill, that a contribution from a particular source of revenue could not exceed 5%. Is that
So-
resonating with anybody? I'm trying to put that together
that's-
with which.
And I asked the question about that based on a conversation I had with Maria, which essentially that's if it is a fee and this is a tax.
Okay.
And so that's where Maria is parsing that issue.
Okay,
But we can certainly have her back in to discuss it further.
it's long, yeah.
Yes.
I raised the issue, with regards to distance between hookups.
Mhm.
Whether we apply our fee or whatever it is to linear feet of something rather than some other mechanism, linear feet of cable, where we want is eminently measurable and definable, and some of the other ways of applying it work, it's potentially quite fuzzy.
Yeah, Representative Sims and then Andrews.
Just flag that I do know that I think there are a few other people who are certainly still interested in testifying that may not have mentioned already, including Barb Neal from E911. And I know they may flag something that I heard from a few other folks around I think generally people support the concept of moving to the per line charge for the Universal Service Fund. There was a little concern about kind of how the waterfall functions and maybe exploring dedicating a certain portion of the Universal Service Fund to the beneficiaries so that there's a little bit more confidence about what people will get from that. So just another person to hear from.
Representative Andrews.
I'm also, and I'm gonna be a little fuzzy, so stick with me for a second. I think Scott mentioned a concern about like if we're doing a pole attachment fee, that might disproportionately hit rural communities over more urban communities because they just travel further distance. And I think maybe trying to solve that with linear feet of wire might have the same effect. So I guess I don't have a specific need for testimony in mind, but I think that's something we should just be thinking about and trying to solve.
Absolutely agreed. And I know that when we set like,
Yeah.
there's the above ground, below ground, there's the
Yeah.
just doing it by the feet, that's confusing, or doing it just by the attachment. I think you have the same problem in both those places.
Does the, Per county
the per
charge.
county, and then I think one of our witnesses pointed out very well that like, when we have sort of a stepped system, there's gonna be people who are on the wrong side of the step always. Yeah, Representative Sims, Masland, Anthony,
Right, just regards to poll.
or Masland.
My,
It wasn't, but go for it.
all right, okay, then wait. But with regards to pole attachments is a concept or an entity or something that happens. When a cable company or EC Fiber or XUD expands builds out. There's pole attachments when new cable is attached to poles. It's a one-time fee that's already paid to Green Mountain Power or WEC or wherever it is, just to attach a new cable to an existing pole. Somebody owns it. So the notion of pole attachment has already been out there and it's pretty well understood. The question that we're contemplating, is this an annual, is it periodic versus just one time? And so, as I said, I'm sympathetic to the issue of rural areas. Julia and Catherine about, in rural areas, maybe there's, longer distance to travel. On the other hand, there's state grants available for a lot of that build out, which the CUDs access routinely, compete for. And as I said, I would favor fee application just because it's straightforward, everybody understands it. So my short version is that over time, the issue of rural versus urban, I think, will become less significant because everybody needs broadband. We ever need to build out the last mile regardless. So.
Okay. Oh, yeah, you were next.
Yeah.
Sure.
I think I hear a bunch of questions, both about the details of the state right of way and the pole attachment. And I also hear some sort of like broader questions about, is this the direction we want to go to? And I wonder whether it's helpful before we got into the weeds of either of those, to sort of clarify the directionality of the committee. Like, it's probably not worth being down in the weeds on pole attachments or state right of way if we decide that, like, I think just, one case folks were making is that building out broadband is an important priority, and anything we do to make that more expensive is going to undermine our goal. And if we buy that argument or some other argument, and therefore decide not to pursue either or both of, it's probably not worth too much time in the weeds.
I appreciate that very clear way of helping us get something done. I know actually for me, it's the weeds that are what those two proposals strike me as, right now, they've been described as too complex to implement. And I actually have no idea if that's true. And so I need to spend at least a few more minutes in the weeds to know if I find them likable or not. And I think that might just be like, hearing from one or two witnesses, but I think that's a really good point. I don't want to fine tune every last bit of legislative language and then everyone's like, oh, we actually never liked this section in the first place. That would be a waste of our time. Yes. Representative Anthony.
We, or I, suggested amongst the neighboring states for the poll assessment, chose a model where it was essentially cost-based. That is to say, in the lesser populated areas, the per mile was higher. That's antithetical.
For the state right of way.
Excuse me?
For the state right of way.
Yeah, but that logic is antithetical to how we ended up benefiting from rural electrification 100 years ago. And I guess we should decide whether we purposely want to use the customer density in the urban areas to subsidize getting out to the rural areas in this bailiwick, as well as the build out for broadband, which is how that's happening, or not, or you want it to be cost-based. A mile costs more when you're out in Corinth than when you're in Chittenden County. It's as simple as that. But do you want that logic or don't you? I think it's a pretty basic question.
I also was what we're talking about regionally. Whatever they're doing in Maine was sort of interesting and I'd never heard of it before. So
What it's being proposed.
yes, what they're proposing to me, yeah.
On further thought, I'm not sure if I'm so apt to sign off on the personal property and the 70 cents per line.
Okay.
I was sold on the personal property representative partly because many towns don't have it.
Right.
It's very unevenly applied. I mean, I think there are only 40 communities that have personal property schedules. Everybody else just has real property and that's it. So it sort of benefits only 40 of the 240 towns.
There's a reason why.
It's very odd.
There's a reason why 230 don't do it.
Yeah, I understand.
I think that's why the tax department is interested.
Yeah.
It is consistent. Representative Maslin, you can have the last word and then we're gonna, unless, with your hand up? Okay, you were just scratching your head. Okay, great. Representative Maslin, you have the last word. Make it good.
Thank you, Madam Chair. It's good. Sprinkle this whole discussion.
It's not how you have a good last word. I mean,
I need to point out that a number of the CBDs have made a decision on their own to build to the last mile first,
Mhm.
and then to try to get to the urban areas where there's more density. And it is financially problematic for them to do that. But it is necessity. It's absolutely necessary. Not necessary because like Comcast couldn't give a hoot about the boonies. And so they did that by applying for and receiving state grants from broadband board, stuff like that. And it's a model that works, but it is a different approach quite than what we're talking about here.
well, actually, I think what's interesting is that that exact point about sort of prioritizing the last mile is antithetical to what you were saying earlier today about trying to have as simple a system as possible.
Well, I see them being closely aligned, Madam Chair.
'Cause I think-
Just articulated.
Because I think the simplest system as possible situation, if you, then you wind up sort of counting or doing it per mile or per attachment. And then the last mile areas are where you're going to see the most of that. And you're going to wind up taxing those areas
Well,
higher.
Not to
But
pick-
maybe my math is a little.
No, not to pick a fight.
Just have a fight.
One is, how are we gonna finance what we're trying to do statewide?
Mhm.
And help Lauren Glenn, and, that sort of stuff, which is the core of the bill.
Let's call it public access and not Lauren Glenn.
Let's call.
She's very nice and all, but-
Yeah. How are we gonna manage continued finance for public access? And its very aspects of things like 9/88 and various other things that are really concerned. That's one approach. Versus how do we, how might we use the fees or taxes or whatever we're talking about in the bill to actually enhance the CUDs that reach the last mile? Which gets to the same thing from a different direction, I guess, So I'm just pointing that out.
Okay, thanks.
And I do just want to frame that maybe we were working on it together, but with different goals. My goal was modernization and consistency across telecommunication providers. That's problem solving for one particular need, but trying to.
And I was never opposing the bill to help one area or another, I was very much your perspective. I'm just pointing out, as we have this, there are different pies out there that are kind of.
Okay, thanks, everyone.
Right, approaching different.
Are we not starting until? Great, okay.
It's actually kind of listening.
Yeah. So it's very possible that we are not going to start until 10 o'clock tomorrow morning. However, can you assume that it's 9 and just check to see if maybe you get that extra hour